Hello, I'm Dr. James Atkinson. Thank you for joining me. Today, I'm going to discuss obesity. And specifically, we're going to talk about severe obesity and the treatment options being on operation. There are many treatments for obesity. Depending on what level of obesity you have, dictates what the operation would be that would most benefit you. So we're going to discuss operations today. Later on, I'm going to go over obesity and the prevalence of obesity, what is involved in what causes obesity, the operations, and then what you need to do to be successful after the operations. So I'd like to start my discussion with the question, obesity surgery, and is it right for you? The reason for that is the operations are extremely effective. The operations are very effective. Someone can lose all of their excess weight and keep it off for the rest of their life if they make the lifestyle change, which we'll talk about as I go through this. However, it does take some change and it does take some effort on your part in order to be successful even with the operations. Today I'd like to answer a lot of questions that people may have about the operations, a lot of myths that are involved with the operations, and really most importantly what you need to do to be successful with the operations. So as we get started, I'd like to first show you a map of the United States where over the last 20 years there's been a dramatic rise in obesity in America. We've all heard it on the news and in the newspapers, and it's certainly out there, but when you see it visually, it's pretty impactful. And this map of the United States from 1990 shows you that as the colors change in the states, obesity in that state is growing. Now there's three levels that we look at. There's normal weight, there's overweight, and then there's obesity. And there's different forms of obesity we'll get to in just a minute, but we're basically talking about obesity. So in 1994, that was the way that the map of the United States looked. As we go to 2000, or 1999, excuse me, you can see the colors are changing, and as we advance to 2004, the red shaded states are greater than 25% obesity in that state. The most recent estimates by the Centers for Disease Control is that 33, one-third, one out of every 3 Americans is considered obese. So pretty alarming, certainly alarming. We're going to talk about why that is and what we can do to, 1, prevent it in some cases, 2, treat it for those who have severe forms of obesity. So what causes obesity? I mentioned earlier, multiple causes. There's a bigger genetic link now than what we once knew. In the last 10 years, a lot of research has shown that genetics is very strongly linked to severe obesity. So we'll kind of talk about that, but there are other problems. Medical problems can cause obesity, but I'll show you that's actually the exception. It's obesity that causes the medical problems. I'll show you medical problems that are caused directly by obesity, which really makes it a very severe disease. Obesity is a very bad disease because it causes a lot of medical problems just by itself. And then also the environment. Certainly in America, we have access to everything. Food, relatively cheap. The problem in America over the years, though, has not so much the quality of food. We do have a pretty bad diet. The problem in America has been the growth in portion size over the years, and we've become accustomed to these very large portion sizes that are very much, too much for the body. Americans on average can eat 2 to 3 times the amount of calories that the body actually needs. So if you have the genetics and the propensity to store calories as fat, then that's a big problem. So what we're going to talk about and what the operations in simple terms help us to do is to reduce the amount of food or the portion size to a more normal portion size, which allows us to control calories. So I mentioned there's multiple things that cause obesity. There are 3 factors, though, that really equal weight and will dictate what somebody's weight's going to be. 1 is appetite. 2, and most of us are familiar with appetite. 2nd is something called satiety. The 3rd is metabolism. So I'm going to discuss each of those 3 and how they play into weight and what we need to do to control them and how the operations actually help us to do that. So if we look at metabolism, metabolism is difficult because metabolism, there's 2 parts to it. There's calories that come in and the body's ability to store those calories as fat versus not store them. And then there's the second part of metabolism, which is the burning of calories, which is the out part of the metabolism. The in part of metabolism, we don't really have a lot of control over. You cannot control what your cells and what your body's doing and how it handles calories. That's a genetic thing. So we cannot control that side of it. We can control calories, and that's what we'll talk about with the other 2 factors. On the other side, the metabolism, we can affect the burning of calories by exercising. That can help. That can help with weight loss, but we'll get into that a little bit more in a few minutes. Weight loss through exercise is very inefficient, but we'll talk about that again. I'll touch on that in a minute. So let's go back to the metabolism in the end. So if we look at the other two factors, appetite and satiety, appetite is the signal from the brain to the stomach that tells us we're hungry. Okay, everybody's pretty familiar with that. You know, some people have very large appetites and are very hungry. Other people, not so much. If you have a low appetite, you're not likely to eat as much because you're not hungry. If you have a large appetite, you may eat a lot. But appetite is very subjective. Appetite is, for some people, it may seem like they could eat a house, and other people, it's like they're not, a little sandwich fills them up. But let's move on to the second thing, satiety. Satiety is actually the opposite in some ways to appetite. It is the signal from the stomach back to the brain that tells us we're full, we've had enough. So if we look at those two and how they play together, and then the three with metabolism, appetite, somebody can have a huge appetite. In fact, you can have somebody in the normal weight category that has a huge appetite, but when they sit down to eat, they eat half a sandwich, they're full. No damage done, no harm in half a sandwich. There's not enough calories in half a sandwich to really store as fat and to become a weight problem. So when you go to the other extreme of obesity, into the severe forms of obesity, that satiety, which is the feeling of being full, the stomach full, sending the signal back to the brain that says I've had enough, that half a sandwich for that person doesn't even begin to satisfy them to say I've had enough. So it may take 2 plates of food, maybe 3 plates of food to have that same feeling of satisfaction. So satiety, of the 3 factors that I mentioned, is really the important factor, because satiety, if we can control satiety, we can control weight. In the person with a huge appetite, they only had a little bit of half a sandwich. That's not enough to store as calories, so no harm done, they didn't gain any weight. In the severe obese person though, the satiety, if that's not satisfied, they will bring the calories in and then metabolism will store them. So the only way for us to successfully deal with metabolism is to essentially take it out of the equation. The only way we take it out of the equation is to not have the calories come in where they can be stored as fat. So again, if we can control satiety, then we can control weight. How we control satiety, that's where the operations come into play. For the most severe forms of obesity, that's where operations are effective and help. In simple terms, and we're going to talk about the operations in detail, but in simple terms, what we are doing with the 3 operations that we're going to discuss is that we are reducing the size of the stomach. What that allows for is a smaller portion or a normal portion of food to come in, fill the smaller stomach, send the signal back to the brain that says I've had enough, and then satisfaction is achieved and they're not hungry, and so they eat less over a 24-hour period. Less calories means stable weight, controlled weight, normal weight. We'll talk about how all those factors play as we talk about the operations, but essentially the operations are reducing the size of the stomach, okay? So let's talk about obesity itself. What is morbid obesity? We've all heard the term morbid obesity. We usually just kind of refer to it as severe obesity nowadays, but it's hard to talk about just weight, because if I say somebody weighs 300 pounds, if they're 7 feet tall, it's not a big deal. If they're 5 feet tall, then there's a significant difference. So what we usually talk in terms of is something called a BMI, or a body mass index. And all that is, it's a fancy term for just putting your weight relative to your height. So a BMI of 40 is roughly equivalent to 100 pounds overweight for that given height for that person. Very easy to figure out your BMI. There are many tables. You can just look up your height and weight, or on the website you can just type in your height and weight and it'll tell you what your BMI is. So a BMI of 40 is roughly equivalent to 100 pounds overweight. So let's look what is normal in terms of BMI. A normal BMI is 19 to 25. You're considered overweight if your BMI is 25 to 30. Now, interestingly enough, 70% of America falls into that category and beyond. So only 30% of America technically is considered normal weight. The next level up is obesity. That's the map of the United States I showed you, where now a third of America is considered BMI 30, which is obese and above. There's actually 3 levels of obesity. There's mild obesity, and then there's severe and morbid obesity. Traditionally, as far as operations go, BMI of 35 and above is the requirement to have surgery. Recently, and some of you may have seen in recent news, the FDA is in the process of bringing that number down to 30 for the gastric band operation. We'll talk about the operation so you understand a little bit. It's a less involved operation, but the BMI can be 30 and above in some operations. Okay, so let's look at the BMI range for just 1 second and talk about that. So we're reducing the size of the stomach, which allows for a normal portion of food to come in. If we compare obesity as a disease, which it is, because those factors, satiety, the main one, appetite and metabolism, are controlled with a lot of genetics being involved. So as you have mild obesity or even just overweight, those factors aren't so strong to where diet and exercise may be effective. You may be able to keep 15, 20 pounds off. Most of you know, and through talking with friends and whatnot, that even maintaining a weight loss of 15, 20 pounds is very difficult. So when you get to the more severe forms of obesity where somebody is 80, 90, 100 or more pounds overweight, keeping that off and maintaining that is very difficult, if not impossible. Most of you have dealt with dieting, and losing the weight is not the issue. Losing the weight can be achieved. Maintaining it is what is nearly impossible, though. So if we look at obesity as a disease, if we compare it to a disease which a lot of you are more familiar with, diabetes, very similar in some respects as far as what's required to control it. We have medications and all sorts of things for high blood pressure, diabetes, high cholesterol, cardiac risk factors, all sorts of things. Very ineffective treatments for severe obesity with medicines alone. The most effective treatment for obesity has been surgery. Since 1991, there was a consensus conference by the National Institutes of Health, and they concluded that surgery is the only effective treatment for long-term severe obesity. They reconvened in 2005, nothing's changed. An operation is still the most effective treatment long-term for severe obesity. So if we look at comparing obesity to diabetes, on the mild end of obesity, like diabetes, it can be controlled with just diet. Just you got to watch what you eat, whether it's controlling your sugar or whether it's controlling your weight. As you progress through the stages of obesity, however, you start to require medications for those forms of diabetes in that same category. And at the most severe form of diabetes, you are required insulin to control your sugar. If you don't have that outside help, being insulin to help control your sugar, it's impossible to control the sugar. Very similar to obesity. When we get to that level of obesity, severe and morbid obesity, without some outside help, and that outside help is reduction of stomach size to allow for a normal portion of food to be eaten, it is nearly impossible to control your weight. Most of you know that. Most of you have dieted and lost the weight, but there's a greater than 95% failure rate, meaning that you gain the weight back within 1 to 2 years with just obesity. That number goes up to 99% and higher with severe obesity. So that's something that is not new to the people who are considering an operation for surgery. The operations, and we'll go over the numbers and the success of the operation in a few minutes, but that currently is the only effective long-term treatment for obesity, severe obesity, excuse me. Okay, so as physicians, we tend to focus on what obesity causes. And a lot of times we look at medical problems, and those are very important. We're going to talk about those. But there's another side to it that most of you have dealt with for your entire life. That's what we call quality of life, or the non-medical problems. Psychological issues, all sorts of discriminations, and physical limitations. I showed you a map of the United States where nearly 1/3 of America is now considered obese, yet we don't accommodate that at all as a society. Whether it's airplane seats, bus seats, theater seats, whatever it may be, we don't accommodate that. Along those same lines, discrimination, in my opinion, airlines can actually charge double for someone to have to buy 2 seats to fly on an airplane that's part of the United States, and the citizen of the United States has to pay for 2 seats instead of having a seat that is more normal size, because they're even small for a normal sized person. But that's something that most of you have dealt with for your entire life. When we look over at the other side of it, which are the medical problems, obesity affects our bodies in a very negative way from head to toe. It affects in a negative way nearly every organ system in the body. If I start at the head, there's a condition called pseudotumor cerebri, where you have increased incidence of headaches with obesity. Down into the head and neck, a condition called sleep apnea, because of all the soft tissue in the back of the throat, which causes a lot of problems just by itself, a lot of oxygenation problems. Down into the chest, a condition called hypoventilation syndrome. That's where your lungs don't expand to get the oxygen that's adequate for you. And the reason for that is in obesity, your abdominal cavity takes up half your chest cavity. Our lungs are little sponges. They can only expand in the space they have. They can't push things out of the way. So in a normal weight individual, the lungs are expanding like this. In somebody who's severely obese, they only have the space to expand like this. So that causes oxygen problems. Also in the chest, high blood pressure, which leads to heart attack and strokes. Down lower into the abdomen, acid reflux or GERD, or a lot of you have that, heartburn. Over long periods of time, that can cause some types of cancer. Liver problem, a fatty liver, or what's technical term is non-alcoholic steatohepatitis, but over time the fat deposits take over the normal liver tissue. Gallbladder problems, gallstones. Down lower into the pelvis in women, infertility, because fat tissue causes an imbalance in the female hormones, so the menstrual cycle is not running properly, so they can't become pregnant. They've tried for years and can't become pregnant. A lot of times that's because of weight. Urinary bladder, a condition called urinary stress incontinence, where the abdominal pressure overrides the urinary bladder pressure, so if you laugh or cough, you leak urine. That's a condition called urinary stress incontinence. If we go out into the extremities, increased swelling in the lower extremities because the fluid can't get back up to the heart, so that's over time, your legs have swelling and the swelling doesn't go down. The joints, which is pretty straightforward, but arthritis and the symptoms of arthritis because of the weight on the weight-bearing joints. And then things we don't even think about, but our skin is an organ as well. Increased incidence of rashes and infections in the skin folds because of the heat and moisture. So what this does, and this is why obesity is such a severe problem, because it causes so many medical problems just by itself. Unlike high blood pressure does not cause diabetes and a bunch of other things. It's high blood pressure. Diabetes is diabetes. Sleep apnea is sleep apnea. Obesity causes diabetes, it causes high blood pressure, it causes sleep apnea, it causes problems with triglycerides and cholesterol and cardiac risk factors. It causes all these different kinds of problems. So if we can control the one cause, which is the weight and the obesity, then we